What is deep brain stimulation? A procedure in which electrodes are implanted in the brain, now used to treat for depression. Physicians at the University of California, San Francisco have successfully treated a patient with severe depression by recognizing and tapping into the brain circuits linked with depressive brain patterns. The physicians have tried to reset these patterns, which they have said is the equivalent of using a pacemaker for the heart. The work, which represents a landmark in the use of neuroscience to treat psychiatric disorders, have been published in the journal Nature Medicine. The doctor used an existing technique called deep brain stimulation, customizing it for the patient's case. DBS is a surgical procedure in which electrodes are implanted into the certain brain areas. These electrodes or leads generate electrical impulses that control abnormal brain activity, according to American Association of Neurological Surgeons. The electrical impulses can also adjust for the chemical imbalance within the brain that cause various conditions, the AANS says on its website. A DBS system has three components. The electrode or lead. This is thin insulated wire inserted through a small opening in the skull and implanted into a specific brain area. The extension wire. This too is insulated and is passed under the skin of the head, neck and shoulder, connecting the electrode to the third component of the system. The internal pulse generator is the third component. It is usually implanted under the skin in the upper chest, according to AANS. Conditions that are traditionally treated using TBS include dystonia, epilepsy, essential tumor, obsessive compulsive disorder, and Parkinson's disease. In treating depression, however, previous clinical trials with TBS have shown limited success because most devices are only able to deliver constant electrical stimulation to one area of the brain, UCSF noted in a press release. During the treatment, UCSF physicians customized a new DBS device which would stimulate the brain whenever it recognized the depressive pattern. Additionally, the team of physicians has also found a neural biomarker that indicated the onset of symptoms. Using the customized DBS device, they are able to stimulate a different area of the brain, which in turn created immediate therapy for the brain. Thank you.